I need to I need to test the ability to calculate the client using subtraction. So I have some this assessment, ma'am. I have questions about you that using a subtractions. Can you subtract 100 minus 50?
100 minus 50 is equals 50.
So based on messaging, the client can answer can answer accordingly. So after that, I need to apply Gloma skills. The if the client can respond or the unverbal response. So based on my assessment, the client can respond what I told to her. She responds my questions and she answer it. So after that, we will continue for the assessing the cranial nerve of the client. So first of that, I need to perform the olfactory or cranial nerve. So I need to test the cranial nerves and I need to ask the client to close her eyes and also to identify if she smell what is the name of the coffee while she's smelling using her nose. So actually I provide these two coffee, then she know how to identify the brand using her nose to smell. So ma'am, can you close your eyes, then can you identify these two coffee if what is the name of the brand? So first she smell and then the next. So what is the name of this in the
It's a Grady's wine.
So how about in this side, ma'am?
Coffee blanca.
So based on my assessment, the client can identify if what is the name or using her nose she identifies. So based on my assessment, there's no problem on her nose. So let's continue for the optic. So I need to ask the client to read the Snellen chart. So let's assume that the client can read the Snellen chart. So let's assume that this will be a Snellen chart.
So guidance.
So let's assume that the client can read. So based on the assessment, the client can read the Snellen chart accordingly. So based on assessment, her eye can there's no problem on her side. So let's continue for the oculomotor. So I need to assess the circular movements and the pupil reactions on her eyes. So based on my assessment, there's no problem about her pupil. So we need to proceed into the cranial nerve, the trochlear. I need to assess the 6 ocular movements. So based on my assessment, there's no problem. So I need to sit and then can you so we need to proceed to the cranial nerve for the trigeminal. So while the client looks upward, lightly touch the lateral, the sclera of the eye to elicit the blanks or pupil. So I need to look and observe her eyes. So can you up, down, and down? So based on my assessment, there's no problem because the patient can relay what or can respond. So I need to proceed into the I need to test light sensation, have the client unclose his eyes and wipe the cotton over the client's forehead and the paranasal sinuses. So let's assume that I have a cotton.